3 prunes every morning for 7 days. If you're dealing with hard stools, straining, irregular movements, or that frustrating sense of never fully emptying, what happens inside your bowel over those 7 days comes down to two mechanisms most people never think about. One is fiber, the other is a sugar alcohol that does something ordinary fruit can't. But whether 3 prunes are actually enough to change your pattern in 1 week depends on something most sources leave out. To see if this works for you, you have to know exactly where your digestion stands right now. This means keeping an honest, mental bowel diary before eating your first prune. Start by looking at your current pattern. How many days a week do you actually pass a stool? When you do, is it hard, lumpy, and difficult to pass, in what doctors classify as type 1 or 2 on the Bristol scale? Or is it smooth and sausage-like? Note how often you find yourself straining, or if you regularly leave the bathroom with that frustrating sensation of incomplete emptying. This baseline is your true comparison, rather than an overnight miracle. While medical science supports the digestive benefits of prunes, no clinical trial has ever tested this exact 3-prune, 7-day morning schedule. The existing research instead looks at larger daily portions, often between 5 and 12 prunes, eaten over several weeks rather than a single week. Because of this, a 1-week 3-prune routine functions as a food-based observation rather than a medical prescription with guaranteed outcomes. This distinction is important because dried fruit behaves differently in the body than concentrated juices, heavy fiber supplements, or pharmaceutical laxatives. You are exploring how a modest dietary adjustment affects your own system, relying on indirect evidence to guide your expectations. This means your individual results may vary, and the timeline is a pattern of probability rather than a certain biological schedule. 3 medium prunes supply approximately 2 grams of dietary fiber, alongside a naturally occurring sugar alcohol called sorbitol. Gastroenterologists attribute the digestive support of this routine to how these two components interact within the digestive tract. The insoluble fiber adds physical material and bulk to the stool, stimulating the natural movement of the colon. Simultaneously, soluble fiber, such as pectin, blends with fluid to create a gel-like consistency. As these fibers move through the system, the sorbitol, which varies slightly by prune size and brand, remains largely unabsorbed by the small intestine. It passes into the large bowel, where it exerts an osmotic draw, pulling water directly into the intestinal contents. This process potentially transforms a dry, compact stool into a softer, more pliable form, which can translate to an easier passage with less physical straining. However, this biological teamwork is a localized softening mechanism, quite distinct from physically accelerating the speed of your entire digestive system. It is a practical, physical partnership of bulk and moisture rather than a magical shortcut. Clinical studies offer a clear picture of what larger portions of prunes can do. In a trial by researcher at Alluri, 50 grams of daily prunes outperformed psyllium husk for easing constipation. Another study by Professor Ellen Lever at King's College London tracked daily portions between 80 and 120 grams, showing significant increases in stool weight and frequency. These clinical trials typically use 50 to 120 grams of prunes per day, much larger than the roughly 30 grams found in a 3-prune serving. A major 2022 meta-analysis of these trials revealed a modest average increase of about 1 additional bowel movement per week, along with softer stool scores. A preprint report by researcher Koyama noted improvements in hard stools, flatulence, and incomplete emptying after just 1 week of daily prune juice. However, these studies rely on relatively small groups, self-reported diaries, and occasionally include industry funding. Because a 3-prune morning routine is a much lower dose, your own response will likely be smaller and less predictable. The science points to a gradual, helpful trend rather than an overnight flush or a guaranteed cure. On the first morning, you eat the 3 prunes and drink your water. It is common to experience no immediate change in your bowel movements on this first day. Digestion takes time, and a quiet start is completely normal. In fact, seeing no difference is still useful data for your diary. Over the first 48 hours, you might notice subtle shifts that only make sense in hindsight. You might feel mild abdominal rumbling, a bit of gas, or slight bloating as your gut processes the new fiber and sorbitol. These are typical early sensations, not signs of failure. Even if you do have a bowel movement on the first or second morning, it does not guarantee that a permanent 7-day pattern has been established. Your focus during this initial window is simply observation. Note the exact timing of your routine, how your stomach feels, and any immediate physical sensations. Write these details down neutrally, avoiding any speculation about the cause. You are setting up a personal baseline, allowing your body to respond at its own natural pace. By the middle of the week, the real test of the routine begins to show up in the physical experience of passage rather than just the frequency of your visits. You're looking for a shift in texture. If your stool was previously hard, dry, or lumpy, you might notice it becoming less compact and more cohesive. This structural change directly impacts how much effort you have to exert. It is important to track straining as its own distinct variable. You might find yourself spending less time waiting on the toilet with the stool passing more naturally. At the same time, pay attention to urgency and how it feels. A stronger, more sudden urge can sometimes occur as the gut adapts, which might bring temporary mild discomfort rather than immediate relief. Another key factor to monitor is completion. Note whether you leave the bathroom feeling completely empty or if you still experience that frustrating sensation of blockage. Ultimately, finding regularity with this routine does not mean expecting a dramatic, life-changing bowel movement every single morning. Success is often much quieter, simply a smoother, quicker process that requires less thought and far less physical strain. By the 7th morning, you're looking at the overall pattern of the last 3 days against your baseline diary rather than celebrating a single favorable bowel movement. This final stretch reveals how your system truly adapted to the three-prune routine. The real-world results of this experiment vary. For instance, a 52-year-old participant named Anna logged softer stools and significantly less straining by day 7. Conversely, a 60-year-old participant named Mark noticed no meaningful change in regularity, reporting only an increase in flatulence. In some cases, the introduction of sorbitol and fiber can cause more acute reactions like loose stools or discomfort. A 48-year-old participant named Lena experienced severe abdominal cramping after eating the prunes, prompting her to halt the routine and seek clinical advice rather than continuing to self-experiment. These distinct experiences show that a minor dietary adjustment is not a substitute for medical treatment. If you experience severe pain, bleeding, or other concerning symptoms, you must consult a physician immediately rather than delaying care. Additionally, while a 7-day trial can help ease passing stool, it is too short to alter your gut biology permanently. Lasting alterations to your microbiome require at least 2 to 4 weeks of consistent dietary changes. Day 7 is simply an observational peak to help you decide how to adjust this habit for the future. To establish a reliable framework for observation, registered dietitian Barbie Cervoni recommends starting with a consistent serving of exactly 3 whole-pitted prunes each morning. Chewing each prune thoroughly is necessary to break down the skin and fully release the soluble pectin and sorbitol. This serving is best accompanied by a standard glass of water. Rather than forcing excessive fluids, maintaining normal, everyday hydration is sufficient to support the natural softening and bulking of the stool. While morning consumption serves as a useful routine cue, clinical evidence does not point to any specific time of day as a physiological requirement. Of greater importance is keeping other dietary variables stable. Introducing other high-fiber foods or supplements during the week makes it impossible to isolate the prune's actual effects. Furthermore, escalating the dose does not automatically yield better results. Consuming more than the recommended serving frequently triggers gas and abdominal cramping. Certain health profiles require careful consideration. 3 prunes contain approximately 19 grams of carbohydrates and 11 grams of sugar, a relevant factor for anyone monitoring blood glucose. Individuals with irritable bowel syndrome, sorbitol sensitivity, or a history of frequent diarrhea should also proceed with caution. Additionally, this portion supplies about 220 milligrams of potassium, which requires caution for individuals with kidney disease or those taking medications that affect potassium balance. Finally, various common prescriptions, including opioids, iron supplements, and anticholinergic drugs, are known to contribute to slower digestion. If medication is the primary cause of sluggishness, patients should discuss the issue with a clinician rather than independently altering their treatment. Should digestive discomfort worsen during the week, it is best to halt the routine rather than increase the serving. While a simple morning food routine is a low-risk option for mild sluggishness, Certain symptoms signal that self-experimentation must stop immediately. Severe or worsening abdominal pain, persistent vomiting, or a complete inability to pass gas or stool point to a potential physical blockage rather than simple functional constipation. Any sign of bright red blood in the toilet or dark, tarry stools requires prompt clinical investigation to rule out serious underlying gastrointestinal conditions like internal bleeding or inflammatory bowel disease. Unexplained weight loss, a sudden and dramatic change in your typical bowel patterns, or constipation that continues to worsen despite dietary changes are clear indicators that a primary care physician should evaluate your digestive tract. New or ongoing constipation in older adults should never be automatically dismissed as a normal, harmless consequence of aging or slower digestion. When these warning signs appear, continuing with any home remedy can delay essential medical diagnosis and treatment. Safe digestive care means recognizing when a change in bowel habits requires professional evaluation rather than self-treatment. True digestive comfort is rarely about overnight cures. As we age, supporting our gut becomes a daily practice of listening to our bodies. Small, consistent choices shape our long-term well-being far more than any temporary fix. Your health is a lifelong conversation. What small step will you take for your gut today? Share your thoughts below.